All right. Yeah, thanks for showing up. So yeah, today I'm gonna tell you about a company I've been working on for about 3.5 years.
Very cool.
Yeah, we're Equator Therapeutics, and we are developing a drug to bring that via the natural heat production mechanism used by our bodies to keep us warm. So yeah, the background context for this is the obesity epidemic. Obesity rates have steadily risen since about the 1950s, and so now about 80% of the U.S. adult population is overweight, with about 50% approaching the obesity threshold. And this gives rise to metabolic disorders, with fatty liver disease, type 2 diabetes. Patients with type 2 diabetes have lifespan 10 years lower than baseline. So this is one of the largest sources of morbidity as measured conventionally, putting aside aging. So yeah, you can go ahead. So during this period of time when obesity rates have continually been rising, patients have been told over and over again, well, you should diet to lose weight, or you should exercise to lose weight. And there's a lot to say about that, but empirically, those recommendations have not sufficed to reverse the obesity epidemic. Rather, the situation has gotten worse and worse over time. You can go ahead. So yeah, one reason for that, it takes a lot to undo obesity, and it also the body rewires to interpret the obese state as a healthy body weight, and so strongly resists departures from it. Nevertheless, there have been very major advances in recent times pharmacologically. So there's a class of drugs called GLP-1 receptor agonists. They're highly effective as appetite suppressants. So they basically they send signals to the brain that one is full, reducing appetite in that way. So you have Novo Nordisk and Eli Lilly have developed the most effective of these. Here I've showed curves of placebo versus semaglutide, Novo Nordisk's drug, finding that about a year out from beginning treatment, patients are on average 15% lower in body weight than they had been versus 2 for placebo. So this is a really big effect size compared with what had been observed with previous weight loss medications. And similarly for Eli Lilly's drug, which even has a somewhat larger effect size. Yeah, you can go ahead. So can you move that image maybe to the bottom corner or something? So
no, we can't close it.
Yeah, you can just it's fine there.
Cool.
So now that these drugs are available, lots of attention has gone into marketing and stuff, and so the anti-obesity drug market is set to power is about to run out.
Yeah. Keep going.
Yes, Morgan Stanley analysts estimated that the revenue associated with anti-obesity drugs is slated to rise from 2.5 billion this year to over 50 billion by 2030. And a large part of this is that healthcare systems are finally willing to pay for weight loss drugs prophylactically to prevent worse complications down the line. So there was a similar shift with blood pressure medications back in the 1980s, and patient and physician awareness of relevant issues is growing. And so not only there are these highly effective treatments, but the regulatory and payer system is catching up. So that it's projected that patients will have a lot of access to these therapies. So yeah, now, do these get us all the way to reversing the obesity epidemic? Well, for some patients, the weight loss actually is enough to reverse obesity. But yeah, there are several issues. So one is that existing treatments are typically they're tolerated by most patients, but these treatments cause nausea in a subset who are unable to tolerate them long term for that reason. A fair number of patients fall short of the weight loss needed to reverse type 2 diabetes, and this entire approach of suppressing appetite may be hitting diminishing returns at this point. I mean, people keep tweaking it, but yeah, there's some convergence between the different approaches, and so hitting diminishing returns. Yeah, you can go ahead. So yeah, now basically, if you want to reduce body weight, there are kind of three levers for that. One is reducing food consumption, which is dieting, and also these appetite suppressants, GLP-1 agonists that I was just talking about. Another way in which you can burn calories is via exercise. So food calories get converted in mitochondria to voltage. The voltage can be used to power ATP production, but the voltage also can be dissipated in a second way, which is via heat production directly, mitochondrial thermogenesis. And so, yeah, if you want a complementary treatment modality to appetite suppressants, a natural thing to do is to try to increase mitochondrial heat production. So yeah, that's the premise that Equator is founded on. Yeah, we're developing a drug system like natural heat production. You can go ahead. So yeah, the idea of stimulating heat production to burn calories is very old. So there's this molecule DNP 2,4-dimethyl. It was actually discovered in it was discovered to be a weight loss agent in munitions factories. So it was an ingredient used in explosives. And yeah, and what was observed is that the factory workers working at these factories began to become very thin. So after some investigation, people realized that that's why they were becoming thin. So in the 1930s, this molecule DNP used as a weight loss drug in America, 500,000 people. And it was routine for people to lose 3 pounds a week on this compound. So it kind of spread like wildfire. It was highly effective. Then it was found to be unsafe and was banned by the FDA. Yeah, just getting into something happened with these slides. So yeah, just getting into some of the problems with this. So this molecule has these NO2 groups attached to a benzene ring. That is a structural liability that leads to cataracts in 2% of patients. It also metabolizes to a molecule that increases tumor incidence. You can go ahead. So those are some structural problems with it. It also has the property. So yeah, what you want to do when you burn fat by heat production is to stimulate the native heat production pathways in mitochondria, which are, yeah, you want to induce these electrical currents through the inner mitochondrial brain. And DNP at high doses induces electrical currents through all membranes. And so in doing so, it interferes with basic physiological processes. So that's another problem with DNP. And yeah, this contrasts with the native heat production pathway, which is you have a protein in the inner mitochondrial membrane, and long-chain fatty acids activate that protein, allowing currents to go through the inner mitochondrial membrane exclusively. rather than all membranes. So that's how natural heat production occurs. And this is induced by long chain fatty acids. Ordinarily, long chain fatty acids are not bioavailable, so you can't just eat a bunch of long chain fatty acids and burn calories in that way. Okay, yeah, and then there's yet another issue with DNP, which is that if you look at the blood concentration over time, it initially has a large spike, and then it tapers off after that. And basically, the number of calories burned is proportional to the area under the curve. But yeah, the area under the curve is concentrated during the first few hours. Then in order to get a higher area under the curve, you need to take a lot of it. And if you take a lot of it, then there's risk of death due to overdose from overheating.
Buffer it.
Warfarin?
Or buffer it.
Buffer?
Buffer it.
Oh, can you buffer it?
Yeah.
Do you mean like make the dose response curve more shallow?
Yeah.
So you can produce a controlled release version of DNP or a prodrug, which has the effect of smoothing out that curve. Yeah. So anyway, DNP itself is unusable, but there's recently been a lot of activity on the front of developing safe molecules that that are free of some of the liabilities that I just described. So there's a clinical stage company, Rivas Pharmaceuticals, recently raised 132 million as a Series B. There's Life Biosciences, which David Sinclair's company raised a $82 million Series C. One of their 3 programs is mitochondrial uncoupling, which is this thermogenesis mechanism that I was just describing. Otsuka Pharmaceuticals has a preclinical asset that they're getting ready for clinical trials. So yeah, the space is becoming a thing of focus for investors and pharma companies. And so Equator Therapeutics is working in this space, and what differentiates us is our ability to interrogate natural mitochondrial heat production as a mechanism and basically measure how selectively a molecule is activating natural heat production. So this project was first pitched to me by Yuri Kyrychok, my co-founder at UCSF. He was telling me about this, and initially I was somewhat skeptical. I was like, well, something here is going to fall through. But then as I looked into it more and more, I found myself increasingly convinced that this was a very promising direction. So his lab characterized the mechanism responsible for mitochondrial heat production. It had been known in brown fat to be mediated by the protein UCP1, but his lab investigated that in more detail and then determined the protein responsible for mitochondrial tissue heat production in tissues other than brown fat, AAC, you can advance the slides. So where does this come from? So Yuri developed a method for directly recording electrical currents through the inner mitochondrial membrane. So this involves isolating mitochondria and then teasing out the inner mitochondrial membrane from the outer mitochondrial membrane without rupturing it, quite difficult technically. And then applying the patch clamp technique to use the glass pipette to rupture the cell while creating a seal, inducing electrical current, inducing voltage, and then measuring electrical current. So this is the method that facilitated definitively determining the proteins responsible for mitochondrial heat production, as well as allowing for measuring the extent to which the proteins are activated by a compound, enabling us to optimize for selective activators. So yeah, we've been in addition to being able to measure target engagement, we've also been canvassing chemical space quite broadly to in a search for the best starting points for medicinal chemistry optimization with a view toward developing a best-in-class drug. So yeah, we're looking for the best possible molecule to do this. So you can go back. Okay, there's no going back.
We do it. We have 1 minute.
1 minute left
Yeah.
before questions. Yeah. Okay. So yeah, I don't need to say much more. We're in lead. We're in medicinal chemistry optimization. We have 2 series of compounds that we've advanced to proof of concept, animal efficacy proof of concept. We have a pipeline of molecules that are less far along that we are about to explore. Yeah, and I'll break that thing for you.
Yeah.
So an egg question. I'm sorry if you addressed this, but is it where's it's shown that directly increasing heat output from mitochondria actually makes you like less fat as opposed to just eat more?
Yeah, excellent question.
Yeah.
So it's really interesting because for some
Yeah, so yeah, it's a quite natural question. Like if you run a marathon, for example, you burn a lot of calories, but you're also hungry as a result. So yeah, do you in fact, does inducing this mitochondrial heat production in fact result in weight loss rather than just compensation by eating more? And so we know that DMP actually worked in the 1930s when people took it, that people actually did lose weight downstream of this, and there's a recent clinical trial finding a similar effect. Yeah.
So, okay, so 0.1G bad for you, 1G better for you.
I just want to make sure we're getting some drugs, what they're actually doing, is there increasing the gain efficiency of mitochondrial electron transport chain and breaking stuff that sets up? Is that what's happening?
Yeah. So the question is are these compounds making mitochondria less efficient? And what's the relationship with the electron transport chain? So yeah, these compounds do not they don't interfere with the action of the electron transport chain. What they do is they make the electron transport chain work more because the electron transport chain produces this voltage, and then some of the voltage is being used up for heat production. And when the voltage drops, the electron transport chain works harder to restore the voltage. So you are decreasing heat efficiency in a sense. You're decreasing efficiency for ATP production. Usually the voltage is more specialized, used in a more specialized way for ATP production. Mitochondrial heat production is another way of dissipating the voltage.
So one of the terms you used, though, one of the papers said that there was uncoupling, that it showed like a proton uncoupling.
Yep.
That's usually in the electron transport chain, right? That's what drew me onto that line of questioning, the word uncoupling.
No. So uncoupling refers to an uncoupling between the activity of the electron transport chain and the production of ATP. So those two processes are coming apart by virtue of the voltage being used for heat production instead.
There's just to quickly throw this in, there's a specific toxin, I think it's made by the deadly nightshade, and it's called a mitochondrial coupler. So if you're using the same word and it means two different things, that's probably something to look at.
So I would appreciate a reference if you.
I think Stryer
Okay.
biochemistry.
If you can let me know after, that would be good. Yeah.
Jean?
Are the negative health effects of obesity entirely due to the sort of presence of excess fat, or is there some notion, or is it due in some part to the overconsumption of calories that happen? Like basically, what I'm getting at is this as a substitute for eating less? Will it do the same? Will it have the same positive health benefits, or is it, can now in some other sense?
Yeah, so eating less has health benefits, and those health benefits are not don't result from mitochondrial heat production. I mean, some of them do, but there are health benefits that one does not accrue by activating mitochondrial heat production. But if you want to think about the health benefits, exercise is the right reference point, because activating mitochondrial heat production stimulates the same metabolic pathways as exercise. So you actually have a broader range of benefits, such as mitochondrial biogenesis, that occur both due to exercise and due to mitochondrial heat production.
Lowering the room temperature by 10 degrees.
Do you have any safety data, model from the
So far, so far we've looked at acute safety. We've looked at, just how high can you go before you hit toxicity. We're able to improve on DNP, to be sure. There's still a lot of work to do, as far as we're still in the middle of lead optimization, so there will be like optimization out of safety issues. But at a high level, the main issue with this approach comes from the possibility of overdose, and everything hinges on how large a therapeutic index you can hit. So how large a difference you can get between the minimal effective dose and the minimal toxic dose. And the larger that is, the larger a patient population could benefit from this approach. In order to get something that's prescribable for obesity broadly, like where if a patient living with obesity goes to their doctor can just give them pills, you want to hit a therapeutic index of about 30. So like if a patient were to swallow a month's supply, they would still be okay. And whether or not we can hit that is an open question. Let's see, the question is, there a transgenic mouse model of what? There may be transgenic models that have that property, but there's a slide that I thought was in there that apparently wasn't. So basically, a key thing about this approach is that broadly you can view obesity as arising from a departure from ancestral living conditions to modern living conditions. So there are three relevant respects in which things differ a lot. One is that there's a kind of caloric-rich substances are much more accessible. Another is that people exercise less in modern society. But there's a third thing, which is that people are, per your point, which is that people live more consistently in comfortable room temperatures now. So this heat production mechanism was actually quite a bit more active in the ancestral times. One contributor to obesity is that it's not as active for modern humans. So the mechanism is known to be safe in a sense. Now one might wonder, well, you know, if you're already at a comfortable temperature and you're inducing this heat production, then is that healthy? And the key point there is that the degree to which we are stimulating heat production is quite low. So when you walk, metabolic rate goes up by like 200%, and about 100% of that is dissipated as heat. So about half of that is dissipated as heat. So by contrast, we're looking to increase heat production like 25%. So we're targeting a level of heat production that's about a quarter of that induced by walking. Yeah, and at that level, there's a fairly robust collection of lines of evidence indicating that that's a safe thing to do. Up to a point, heat production just results in capillaries dilating, resulting in the blood being exposed more to the surrounding area. So then the heat dissipates without increasing core body temperature.
Well, thank you very, very much.
Yeah. Yeah. Thanks, everyone.